On this one-on-one, we take a look at the impact of COVID-19 on an institution that continues to be one of the most influential stakeholders in the world, the church. The restrictions over the last year and a half meant a suspension of services at one point for several weeks, and the number of worshippers allowed to attend the services has been drastically reduced. We discuss the implications of those restrictions and what it means for the church going forward. And a very good evening to you. I am Lisa Lord, and my first guest is the chairman of the Barbados Christian Council and rector of this beautiful church here at Mount Tabor, Reverend Dr. Cicely Attil Horsford. Reverend, thank you so much for joining us.
You're welcome, and thank you for having me. It is a joy to be with you this evening.
Indeed, it's a joy to be here. Now, as I said in my introduction, everyone has had a very hard 18 months dealing with COVID. The church is no different. Take me back to the first time when services were halted altogether. What did that mean for the church?
It was a hard thing for the church, simply because when there's a crisis, everyone seeks the help of the church. People would come to the church or would sought out the church for assistance. And so closing the church, helping people to understand what COVID is all about, it was so difficult for us. It was difficult for every member of the Barbados Christian Council. I had the privilege of 6 months later visiting every church head, and that was where they were. Hearing from them was a difficult thing to listen to.
What were some of the things they were telling you?
They were talking about think about the elderly persons, because many of the members are elderly who would find solace, who would find comfort, who would relate to one another. So the fellowship was gone. The coming together was gone. Their source of strength was taken away, it seems as, and therefore that created some problem for them.
Well, you mentioned the elderly, and most of the members across the different denominations are elderly members. And that was one of the main reasons as well for closing churches.
To prevent them from. They are the vulnerable ones. And so it was hard to relate to them and to get the message across. But when they heard, when they understood what it was all about, like, for example, I would say to one that I'm staying away from you, not because I'm running away, but because I am saving you, I am protecting you from whatever is happening. That was hard to tell an elderly person.
The Christian Council and the Barbados Evangelical Association, you were heavily involved in some meetings, most recently about 3 weeks ago, with the Prime Minister and other government officials regarding the direction and the way forward. You also told me off camera that you were instrumental in outlining the protocols for the churches. Tell me about that.
The Barbados Evangelical Association and the Barbados Christian Council, we have a close relationship. And I guess because the two chairs are friends as well, so that lend help to it. We were able to share information, help join with the other faith-based organizations to help the government in putting forward the protocols for the churches. We were the ones that recommended how and why and what to do when it comes to the churches. If you have a chance to speak with Reverend Taylor, Nigel Taylor, he would tell you that he was one that put forward the idea of getting the clergy vaccinated in order to help with the vaccination of the wider church. So we were able to put the protocols. For example, when we were thinking of the curfew, and we were saying, do the timing, we were able to suggest, and we were able to get our suggestions on the table. I want people to understand that, yes, it looks as if the churches are the ones that always get in the licks. We have people who would condemn the churches because you would hear there's a cluster of COVID positive in a church. But the thing is that some of the member churches have been asking the question, when a cluster or when a positive case in, say, a supermarket, they close that supermarket for a day or two, but not all the supermarkets. But when there's a cluster for church, it appears as if all the churches get the blame. All the churches have to be dealt with in the same way. And so we are able to ask the question, can we just close that church? Or can we deal with that particular church? We get the picture. We understand. We are aware of the social issues in the society and in the churches, and we are prepared to protect the members, because if we don't, who are we going to deal with? The empty pews?
And when services were able to resume, you're still severely restricted. We're speaking about at the height of COVID. You had to come up with creative ways to reach your congregation, and many churches indeed started streaming. Were many of the churches already outfitted for that?
Well, some were outfitted for streaming to begin with, so they just went to that platform. Others have to devise other ways of getting the message across, reaching the members. Like I know, for example, I spend days on the telephone reaching members. I would assign myself to do 6 persons a day. Sometimes I only can do 2, because when you get on the phone with one person, you can't just hurry up, oh, I'm just doing this. I have to spend the time with that or those particular persons. So it is important that we reach people another way. The gospel remains the same. The gospel message has not changed. It is the same. The method of sharing the gospel, and COVID has given us new methods. I remember last year the young people used to meet by WhatsApp. And I was concerned about that. But because I'm face-to-face and I'm in-person, but when my young people meeting on WhatsApp, I go like, that's not a meeting. But now COVID shows us that that's a meeting, and that's a good way. So we were prepared to some extent for that. The Christian Council, though, many churches has to invest in equipment, and that helps to deplete our resources. And with the closing of the churches, we have been affected financially, severely.
I was about to say, I know most of the churches depend heavily on tithes, offerings, donations, and the Anglican Church, I know many priests had to take a pay cut, and those
other churches have done the same. I know I'm one that had to take a pay cut. That does not decrease my volume of work, because more than ever our assistants are called upon, and our resources are needed, and our social aspects have to be dealt with severely. There are members in the community that we need to reach. Children, I remember, for example, here at Mount Tabor, we supply tablets and computers to students. There are some students who do not have connection. They do not have electricity. I remember recently a child is online at a class, and that child has to use the internet services of the church to get the lessons. And so we are there, and we understand what the country is going through. We want people to just do the right thing. If we follow the steps of sanitizing, stay your distance, and
wearing a mask.
Wear the mask, as I am wearing now, to demonstrate it. The thing is that we can get through this together, and I want the nation to know that we are in this together, and we have to respect one another and help one another to go through this. There is hope.
And how are you coping financially in terms of the church and your members?
Well, we are making it. We almost deplete our resources, but with God's help, we got to make it. Financially, the church is struggling like the rest of the country, and we understand that. We got that. And so we are encouraging persons who are still at work to do their best. We are encouraging those who can help one another do that. So we encourage persons who would come to church, bring an item or so, and that would help the other person. One member of Mount Tabor would say, if you go into your cabinet, you have more than 2 tins of corned beef, bring one for another person. And this has been working. We have been helping one another. The members of Barbados Christian Council, in fact, that was one of the things that the Christian Council was set up to do in the early 70s, the social aspect of the church, and that's what they have been doing and continue to do. Every member church has a caring ministry, and they share with the persons in the community to help.
You were telling me off camera that for some churches, given the current 25 in-person meet restrictions that we have now, it doesn't make sense for some churches.
Some churches, it didn't make sense for some churches. Hence, at the meeting we had with the Prime Minister and the faith-based organizations, we recommended that they take the floor space. And so there is a form, and we encourage persons to fill this form out. And the COVID unit would come, look at your building and your space, and would approve your numbers. And so that's one way that we can help. The other recommendation we made at that meeting was the mobile vaccination center. And I'm glad that they took it up, and every corner of the country. And if not on church premises, on any available space that they can do the mobile vaccination, that is being done. And we are happy that those recommendations have been taken into consideration.
So across your membership, there is support for the vaccinations?
There is support. In fact, most of the members, the pastors and priests and reverends have been vaccinated very early. In fact, I was in the first batch or second batch of in the country to be vaccinated. And we support and we are encouraging persons for vaccination. We understand those who are hesitant. We understand the concerns that you have. But for the elderly members of the congregations, for their sake, please vaccinate.
And what would you say to the criticism the church has received from members of the public that you're not practicing what you preach?
I think those criticisms are unfair, because if you go to all the member churches, and I have done that, you can see physically that we have adhered to the protocols. All of them have been, and we are looking out to help people. And so it's not fair to criticize that the church is not adhering to. In fact, church does not give you COVID. I think persons who would have gone elsewhere would have brought COVID into the church. And not that I'm condemning those persons who have, because we have to see that ourselves as part of the society. We help persons and give hope and assurance. And so the criticisms I thought was harsh, and I didn't take too kindly to it. However, that is the church normally. Over the years, down the centuries, the church get the blame for a number of things, and rightly so sometimes. Other times we think that it is unfair, like in this COVID time. We are prepared, and we have been helping other persons to adhere to the protocols and follow the guidelines and the directives.
And your advice to Christians, as Christians we're taught to walk by faith and not sight. And you will have people that will say, I'm not following certain things, I'm not taking the vaccine, God will protect me. I'm sure you've heard that.
I've heard that.
Your advice to those persons?
God protects me, but I still put on my seat belt when I'm about to drive in the car. God protects me when I wake up in the morning, but I still do a number of things that I'm supposed to do to help me. And the other part, walk by faith and not by sight, but he also said, the scripture says, God will help those who help themselves. And so we needed to follow the, Lisa, before I could finish that sentence, I just thought of just about emancipation or after emancipation. Here in this area, there was cholera, and that disease was wiping out a lot of Barbadians. And the pastor here at Mount Tabor, Reverend Zippel, he would have received medicines from England, and he ended up helping all the people on the various plantations and in the neighborhood, in the community, and saved them from the cholera. So the death toll was diminished a lot. For me, it's the same thing. And like the book of Lamentation that says there is nothing new under the sun. COVID is not new. This type of virus is a new one, and there is hope. I want to give that hope and assurance. One, that God helps those who help themselves. Two, God is the one that gives knowledge and wisdom and understanding to doctors like Dr. Ford and the medical society to help us. Many persons would talk about they do not know what's in the vaccine, but you do not know what's in the multi-symptoms that you use for the cold, for the flu symptoms that you have, but you take them and it works. Or you do not know how much bush you have to drink in order to be cured. You don't know, but you use it by faith anyway. It's the same thing with the vaccine, the same thing with the protocols that are in place to help everyone one by one. And if each one of us would just do it, if you don't believe me, just try it. Each one of us, with our responsibility, taking on the responsibility, then we will make it as a nation. We will make it as a nation. And I believe that from the very depths of my being.
Reverend, thank you so much for talking to us.
You're welcome. You can call again. And please note, Barbados Christian Council is made up of all these other denominations, and we are there willing to help and are there ready to give advice, and our counsel because of the mental health that is going to be a big thing after we have dealt with COVID.
Reverend, thank you so much.
You're welcome.
And that was the chairman of the Barbados Christian Council and rector of the Mount Tabor Church, Reverend Cicely Attil Horsford. When we return, we speak with the head of the Barbados Evangelical Association.
Let me begin preparations. It's hurricane season. Let me sit down and reason. Let me secure a nation. Know your shelters, Bajan. Help out one another against depression. Develop emergency community plans so that we could function. Remove outdoor objects. Make sure that you went to the ATM. Stock up with water. Make sure you clean the guttering lot. What about canned food? Make sure you got some stock up in your room. Make sure you prop up the paling and tie down the roof. Let me start to prepare real soon. Let me begin preparations. It's hurricane season. Let me sit down and reason. Let me secure a nation. Know your shelters, Bajan. Help out one another against depression. Develop emergency community plans so that we could function.
Vaccines have both protected and kept children healthy from serious illnesses such as whooping cough, measles, crippling diseases like polio, and others. Vaccines help your immune system to do its job better and faster, and that protects you from serious disease. Like a good security guard, the immune system is always on patrol in your body, looking for invading germs. When it comes across a germ, it begins releasing antibodies to fight that germ. These antibodies work to attack, weaken, and destroy the germ. The COVID-19 vaccine is no different. It will work to help your immune system fight COVID effectively. All vaccines go through strict trials before they are approved for use in the population. Even after the COVID-19 vaccines are approved for use in the general population, monitoring for safety continues. Vaccines are safe, and they work.
This message has been brought to you by the Ministry of Education, Technological and Vocational Training, the Ministry of Health and Wellness, and the Pan American Health Organization.
Welcome back, and it gives me great pleasure now to introduce the president of the Barbados Evangelical Association, Reverend Dr. Nigel Taylor. It's been a while. It's good to see you.
Yeah, it sure has been quite a while. But then again, I see you pretty often on TV, so that's all right.
Every now and then, every now and then. As I was talking to Reverend Sicely earlier, COVID-19 has put the churches across the island under quite a bit of pressure. How is your membership dealing with this pandemic?
Well, pressure is mild. It has placed the church generally in a very high-profile position. For the simple reason, the church now has come from under the radar to be specifically on the radar because we have a situation where the COVID-19 and now all the variants are impacting the membership in many ways, many ways. The members are a little reluctant to come to church. And it's not because they don't want to come. It is because I think not very clear on this COVID and not being clear on the variants and what can cause any malady, any major illness. I think everybody is being cautious. And I think that's logical. And really and truly, it is understandable.
And what are your members doing to sensitize their congregations about COVID-19?
Well, lay aside the natural and the national information that comes, GIS and the whole gamut, the churches actually, all over the place, from all the social media platforms, they actually use the social media platforms now a lot to let the people know about COVID, the implications of COVID, the whole idea that these are areas that they should pay greater attention to, the masking, the sanitizing, maintaining the appropriate temperature, maintaining the spacing, and all of this sort of thing. So from time to time, you will find churches using all of the social media that is available to them to engage their parishioners in many ways, whether it's by social groupings, small groups, or whether you are actually, before the service commences, some of them would outline situations like, remember that we are supposed to be doing 1, 2, and 3. So the sensitization within the churches general, and even specifically the evangelical church, is on par with any protocol that is being engaged nationally at this present time.
And I understand that you had a seat at the table in actually coming up with the various protocols that would govern the churches. Well,
let me put it this way. When it first started last year, March, because the BEA was actually a part, and is a part of the social partnership, the Prime Minister allowed the churches to be represented at that August body. So we do have a seat there. However, the BA recognized that this is a new disease. It's a new malady. I mean, we need to know how do we deal with it. We need to know the implications. We need to know the ramifications. We need to know something. Because, you know, if you don't know correct, almost anything at all can play, and you run away with a lot of variables, a lot of interpretations and stuff like that. Yes, when we found out that we needed to know a little bit more with what was happening as it relates to this new illness, we engaged. Well, we engaged. At that time, there was a minister of the government that was a point person. So we would deal with him, and we would engage him with the things that we perceive to be the realistic, second, the pragmatic. It's no sense putting systems in place that are not workable. We must put systems in place, not the systems that work in El Salvador or the systems that work in Colombia. Yes, they may work there based on the cultural penetration, but we need to look at systems that will work here in Barbados with the Barbadian church. So that's what we did. We looked at the whole protocol. We looked at the sacraments and how we are going to deal with the sacraments. And we made the recommendation, the appropriate recommendation based on our experience. Because that's where I go. you need to recognize the church leadership as professionals. And as such, yes, they're ministers of God, but at the same time, they're professionals in their own discipline. So you need to recognize that this is against the backdrop of years and years and years of practice and years of putting thoughts together which can guide the church. The one thing, Lisa, you need to understand is this. The church is a very large constituency. You know, people may not go to church, but you know, whenever something happens, they associate themselves with a church. They will say, that is my church. So without doubt, there are church members directly and indirectly. So we can't deny that fact. So I thought that it is best to couch it this way by saying the church was intimately involved when it first started in making the appropriate recommendations to the government as to the way we see it and how best we can advance. But by the same token, protecting the general membership of the church and the general membership of society.
A year and a half later, has the church adapted?
Well, we were forced to adapt. I mean, listen, pre-COVID, you had a healthy congregational attendance. Early in COVID, when everything was haywire, everything dropped through fear for the most part. Churches have been trying to recover, but the recovery rate is perhaps not as aggressive because some persons have not returned to church since last year, March. And reality is, I do not think it is because they don't want to come to church. I think it is because they are fearful. But then again, you know, some will obviously use that as a crutch. So that's the other side of it. But a year later, I mean, we're in a worse state now in the sense that we have an increase.
We have a spike in cases.
A massive spike, and a variant that seems to it has a mind of its own. So it is taking old, young, middle, all kind of ages. So that is it. And even now, the churches are very conscious of it. I'll give you an example. Earlier this year, we did not have church for 3 months. Since the Delta variant has been so aggressive, churches have reverted to the platform, the online platform for their services. They're streaming still. When the government, the Prime Minister stated that, or when the protocol dictated that you can have 25 persons, the churches still maintain the online platform. They still maintain. Because when you have a church pre-COVID with 200, 100, and 25, you know, there's a problem. The problem is that some persons were only getting to come to church one Sunday in 5 weeks. You also need, you know, in the same way they talk about the schools, they don't have enough laptops and enough of the instruments to be used. You know, there's some church persons that may not be so abreast of the technology because they are accustomed coming to a face-to-face service. So we have actually engaged the online platform, and because the numbers have spiked. Now, it is interesting that this interview is coming right after the highest number we have had, 168. That's really high, and that is cause of concern to the church. And only yesterday, some ministers in the BA have actually told me that because of the numbers, they're going to continue their online services because of this general fear. No, it is not only a fear, it is a concern for the parishioners. Because we have heard there are family clusters, we have heard that the younger ones, we have a lot of preteens. So these are concerns. So the churches are trying to minimize the impact. So what they are doing, they are using or continuing to use the online platform. Some are still dealing with the face-to-face. Granted, the 25, I mean, not face-to-face. The directive said face-to-face, and if you need more persons, you make the application. But somewhere along the line, I think something went wrong because I've been having too many complaints from the pastors that talk about upon inspection, the churches are being given very, very minuscule numbers just above the 25 when their churches. So that's a different story for a different time. But that is some of the things, so some of the concerns. So they are actually dealing with streaming right now for the most part as a way to deal with congregating, as a means of allowing the persons to focus and be safe. So the church has a social responsibility, and that's what they're doing right now. They're continuing to do right now.
Speaking of responsibility, several churches had some clusters. And many people are convinced that it is as a consequence of those particular churches not doing what they're supposed to do. How do you respond?
That's an interesting response. I don't know if you have the whole day, but for the short time, let me say this. I think for the most part, a lot of people live in some kind of vacuum that I am not quite clear. COVID is not a unique, isolated disease that happens now and then it disappears tomorrow. This thing has been, nobody would have thought that in 2021 we would have been dealing with what we're dealing with currently. But what they fail to understand is this. The church is simply a gathering of people. It is a microcosm, among other things, but it is a microcosm of the society. If community spread is there, invariably it will lend or find its way in the church. There is no rocket science for that. It is very clear. If it is out there, because the same people that go to the supermarket in the church, the same people that go to the carriage, the buses are in the church. The same people that go hither, thither, and yon are in the church. So therefore, because it happened in the church, it does not mean the church is the instigator or the church is the demon that thrusts this thing on the community.
So why do you think so much attention was focused on the church then?
Well, you see, the church has a social responsibility. The church, without doubt, has a major role to play in guidance. The church has a major role to play in deliberations. And that is why I have repeatedly said the church should be a partner, even in dealing with this protocol, in dealing with COVID. You can't just sit and dictate on high and think, well, these are the things that should happen to the church. The church should follow these patterns. No, the church, we should be engaged in a conversation, not just when we have 165 persons or 200 persons, and as Dr. Ford said, the projection is anywhere like 500. Well, those are scary, but you should not be engaged in the church in those sort of things, because it is better to have preventative programs and preventative methodologies than to be responding after the fact. So the church the church came to the front because of this. But I will also say this, it is sad that because it happened to a church or a couple churches, that the whole vilification and demonization occurred, because it should not be. It should not be. I honestly do not, well, okay, let me put it this way. If the leadership in churches are not following the protocols, I dare say that it behoves the administration to deal with that church specifically. Don't paint all in one brush. Don't cut the whole branch of the tree because there's a bad fruit on a limb. Take off the bad fruit and let's progress. So I don't think that was the way to handle it, really, because there would have been something, it would be seen as punitive. I think that's where the churches, for the most part, see a lot of this thing happening, because they link it as a punitive action. You're being punished for the indiscretions of maybe one or two churches. But let me say this to you. Do you know how many churches are in Barbados?
Tell me.
I don't know. But I can tell you, there are hundreds. There are hundreds of them. I would take a wild guess to say there are anywhere 650, anywhere in that number. There are a lot of churches here. But do you know the percentage of churches, and I would not be able to give you a true percentage because I don't give you sound empirical data because I
don't know how many
I don't
churches
know how many churches
yeah.
to match the position or the percentage to the ones that were impacted to the ones that were not. But then you also have to give general direction to the ones that may not have known and might have been indirectly impacted, to which we are not aware. The ones that we were aware, the whole concept of church, and BA would have done this if we knew. We did it to the ones that we knew. We try to deal with the matter and see how best we can assist in the whole remedial way, get them back on track. But it is sad because some of the churches I don't even know. To be honest, I don't even know the churches that were impacted because the names of the churches are unknown to me. Because they're not members of the BEA, most of them. So I would not be able to say, well, this particular church, I need to do that. But what I'm saying is that if you know a particular church, I think if that is where the challenge is or was, you need to isolate that church and deal with it. No, I do not mean in an embarrassing way. I mean you invite the church leadership to come and let us see how best we can remediate this matter. And that's how I see it. That's how I see it, personally.
There was also some concern that some of the churches are not properly ventilated because of where they're being held.
Okay, yes. Well, that is an environmental thing, but I can tell you this much. Years ago, years ago, we had a problem in some of our churches where they were talking about when churches wanted to build. So the ministers would have told me that they were told by the authorities in Barbados that the land space is rather limited. So if they can retrofit, big buildings, perhaps a warehouse,
right,
they might grant them permission. I know for a fact that some of them were told that there was serious challenges with churches in communities and the noise level. You remember there was the noise abatement discussion when they could not differentiate what was noise and what the church referred to as worship.
Yeah.
Now, Trinidad made it very clear that it is a big distinction. But Barbados was seemingly wanting to pull it together. I don't know what happened to that, but some communities were saying, we don't want that kind of noise. So the churches were told that you have to be fully soundproof. So how are you fully soundproof?
Air conditioning.
You got to air condition the whole place.
Yeah.
So some of the churches that are air conditioned, at least in the BEA, it was against that backdrop of objections to noise and a facilitation of trying to correct the noise by having the churches soundproof. Now, if you could soundproof without having it fully AC, well, I don't know, but that's what they said. So that is why some of the churches are like that, are fully. And the airflow, I could understand this, but I'm wondering if that was not one of the challenges, because it would have to be something that surfaced recently. Because last year, the churches were at 6 feet, and everything ran smoothly. We were not having all the challenges that churches seemingly to be complaining to me about now. It went from 6 feet to 3 feet, and everything ran smoothly. Churches were not having choirs singing. Churches were having less, I'm talking about evangelical churches.
Right.
They were not having many worship persons on the platform. In fact, the services were being held for less than 1 hour and 30 minutes. Because by memorandum from the BEA, we told them to try to accommodate this, because having a mask on all the time, it's not easy.
Yeah.
And then, the whole stigma now, from the time you give a little cough or you give a little something, everybody looking around, trying to put distance between you and them. So churches were still, even though churches went back to normalcy, people were still keeping service 1 hour, 1 hour 15, 1 hour and 30. They never went past. So they understood.
So you would say your members were following the protocols?
Listen, I am telling you, sometimes, even before the government implemented protocols, the churches in general, I'm not even saying BEA, the churches, because BXC was doing the same thing, the churches in Barbados were following the protocols, overly following the protocols. I mean, remember, all this came at a price, huh? Because when it first started, we had no temperature guns. Temperature guns were like $200. We had to buy alcohol. We had to buy sanitizing stations. We had to buy all the germicides. So we had to spend a set of money up front. Then we had to sanitize the whole building. So up front there was a cost to which we did not, most churches did not budget for, but they had to do. They had to deal with. So having said all of that, the churches in general in Barbados, I have heard the Minister of Health say that. The Minister of Health made it very clear at a meeting that we had with the Prime Minister recently, the faith base, when she met with the faith base. He made it very clear that he must say that the churches follow the protocol. I know that for a fact, that they do. Now granted, I'm talking with a degree of generalism, because you will find the straggling person who might, maybe if he could get around the system, but those are not generally the people that are serious-minded about the people. And that's one of the reasons why I say you cannot deal with all the churches with the same brush or blow. Those that are challenged or having the problem, then you deal with them specifically.
Reverend Hill, I understand that you were instrumental in pushing vaccinations, your vaccination drive to your members.
Okay, that's an interesting thing. Now, I'm not a scientist. Well, I'm not a virologist. I'm not a epidemiologist. But sometimes you have to yield to the knowledge of those to whose field it is a specialty. All over the world, they were saying that you must sanitize, you must have your temperature checked, modulate your temperature, maintain your temperature, and the third one is create a kind of distance, a social distance. People talk about social distancing, yes, physical distancing, whatever the term they use. And then it came on the ground that one of the barriers that assists greatly would have been the vaccine. We're a poor country, so I figure, well, I don't know how we can get the vaccine, but when they come, if the scientists say that, well, I should try. And I'm not dealing with any biblical, eschatological interpretation of whether it is anything relating to end times. I'm not dealing with anything like that. No theological implications. I'm not dealing with that. If the medical practitioners say that, okay, and it is being tried all over, because there must be others across the world. And wherever you have a pro,
there's a con.
You will find a con. So, and that's what makes it so healthy. The discussion is so healthy. So, I mean, I said if you're leaning toward vaccinating persons, you can't leave out the church. I just said that. You can't leave out the church. But I will say this, Lisa. I do not believe in any mandating of vaccine for anybody. I don't believe in a mandatory vaccination. I don't believe in the Medes-Persian law. Well, that Bible talker. In the Medes-Persian law, it says that it has to be. No, I don't go for that. I think people have a right to say, well, I will get the vaccine. If that's what you want, fine. I honestly believe that. The pastors told me that they would like to be vaccinated, some of them, but because at that time it was limited, they would have to go a little while and stay by this polyclinic or that polyclinic. So I simply said, look, let me talk to persons, and I said, well, look, there are some ministers who have in BEA who want to be vaccinated, BXC the same thing, so give us a polyclinic for 2 days, and I will arrange the BEA section. BXC will do theirs, I suspect, and that's what I did for BEA. The 2 days, we vaccinated over 100 and something persons, ministers and wives. Then I realized, you know what? The ministers and wives are vaccinated, but then you have the membership of the church. So I said, well, I need another tranche for these persons. And it happened again. So, I mean, it is like just me being the front person to try to see if I could help them. Because if that's the way you want to go, let it be. Let us err on the side of caution, more so than philosophically erring to say that this is what will happen, that is what will happen. I don't know. But if it is being spread across near and far that this is an effective barrier, I go to the States in the winter, but I haven't traveled much. I haven't traveled at all now since last year.
Right.
But I know for a fact that in the winter in the States, people get the flu shot.
Mm-hmm.
But I also know, and this is what a friend of mine tells me, he says that when they get the flu shot, they contract the flu still because you're in winter. They still get the flu shot, but within a matter of a day or two, they're back on target because it is like a mild flu they get. I just parallel the two. And I say, well, nothing is perfect. If they are vaccinated and they catch COVID, I think it may not be as bad as if they did not.
Mm-hmm. And the data is there to show that.
Yes. So that is my take on the matter. That's my executive take on the matter. And that's one of the reasons why we would push it.
COVID is not going anywhere anytime soon.
Mm-hmm.
Where do you see the church going forward?
Okay. If we are realistic, and we have to be realistic in dealing with the times in which we live, reality is, if it's not going away, we have to modify our programming. We have to modify our concepts, our thoughts, our philosophies. And I think we're getting there, though, you know, because the things that we are doing now in churches were never done in the past. I mean, nobody using a social media platform. No, churches are saying, look, for those who want to come to church, come and be face to face. But those who don't want to come, we'll accommodate you.
Right.
So they're streaming and face to face. The church must rise up. Now, there's a hymn. There's a hymn that we sing. It's a hymn that we sing when we're ordaining people or consecrating people or anything like that. It is called "A Charge to Keep I Have." But there's a verse there that commissions us to say, say something which reflects that we are called to serve this present age. I think the verse says, to serve this present age, our calling to fulfill. That's the line of one of the verses. So the churches must understand, the leadership of the churches must understand that we are operating in a COVID environment. The mass might always be there. The shortened services might also always be there. There are times that you will hear, for due care, we are going to ask the churches to ease services for 2 weeks until we could get the whole thing under control. These are areas that I think the church leadership will need to be prepared for, and I think they will be. Because we have had that going on right now, and I think they have shown a level of maturity. There's a maturation level that shows that they are ready for it. I think the church, the way to deal with this more realistically is for the church, for authorities to take the church a little bit more under their wings. But let me say something. Last year we had a minister who was always with us to guide us. So we made recommendations. 2021, there was no such thing. So there was no point person that we can say, well, listen, let's do this. We want to recommend this. So we were hearing protocols just like you. Or maybe you heard before us, but like all the others, we were hearing for the first time. And sometimes when I heard the protocols, ministers would then call me and say, but Doc, I don't quite understand what they're saying here in this protocol. So you're leaving me now to interpret. And if I interpret wrong, I got it for $50,000. You understand what I'm talking about.
Yeah.
So there are, but if you come and partner with us and tell us, now listen, these are the challenges that we face. Because, okay, the spike in numbers, I knew because I would have been following it on the TV and following it in the newspaper, the dashboard. So I was able to say to my executive, these are some serious numbers. For a country that is so small, 285,000, 300,000, whatever the number is, demographics will show, we're too small a country to be having this rise. So we need to see what we can do or what we can recommend to churches. And that's one of the reasons I said to you earlier, that some church leaders are concerned to the point that they're not keeping any face-to-face right now. So, I mean, you will hear people say, but you know, the churches always want money and all that sort of foolish talk. Now, bear in mind that the church's social program, because you know the social program is the government's program. The government deals with the social programming, but the church has realized that we need to also step up to the bat. So even though we are behind in donations and all that sort of thing, we still cook, we still feed people, you know. There's some churches that still assist people with their care packages. They pay some bills for them sometimes, but there's no revenue coming in. So I really think it's a disservice when you highlight that the churches are keeping a lot of noise because they miss the money. Well, they got the lights to pay for too, but that is not it. You also need to be aware that a lot of ministers are bivocational. So they don't get anything from the church. They lead the church. They minister in the church. But also the benevolent aspect of the church, the compassionate aspect of the church, all these areas of the church, they will suffer. They will suffer because there's no revenue to go to buy care packages for these persons who will have a little bit more pride than to go to the welfare department or to seek the Ministry of MPEA, Elder Affairs and all that sort of stuff. But you see, the church will do that because the church knows that they can step in, intervene, interface, and work with it.
Thank you so much, Reverend Taylor. It's been a pleasure. Really appreciate it. That was Reverend Dr. Nigel Taylor, the president of the Barbados Evangelical Association. I am Lisa Lord, and this was One on One.